Hello, and welcome to Google's Protection from Wildfire Smoke Oregon OSHA Rule Annual Training. I'm your trainer, Timothy Parham. Outcomes and Objectives. By the completion of this annual training, you will understand Oregon OSHA's Protection from Wildfire Smoke Rule and its requirements. This training concludes with a quiz and additional resources to further your knowledge about wildfire smoke protection. This course satisfies the following required training elements: symptoms of wildfire smoke exposure, potential health effects of wildfire smoke exposure, employee rights to report health issues related to wildfire smoke, procedures to follow when an employee reports health symptoms related to wildfire smoke, how to access air quality data, the importance, limitations, and benefits of using a filtering facepiece respirator, methods of protection, including how voluntary filtering facepiece respirators will be made readily accessible at an AQI of 101, an explanation of the monitoring method and two-way communication system used for wildfire smoke exposure control information. Wildfire smoke exposure. Wildfires are occurring more frequently in the United States and present a health hazard, especially for outdoor workers. In addition to emergency responders like wildland firefighters whose mission is to manage the fire, there are many other outdoor and indoor workers who may be exposed to smoke from wildfires. These could include, but are not limited to, non-fire related outdoor jobs such as landscapers, utility workers, construction workers, and park personnel, services that do not include mechanical ventilation, cleanup workers or demolition crews, and workers engaged in supporting a fire response or working at the fire-based camp or evacuation centers. While some of the above work may not present exposure to the physical hazards of the burning flames, exposure to smoke from a wildfire near the work area may occur. Oregon Wildfire Smoke Rule and Exemptions. To help protect workers from wildfire smoke, Oregon OSHA was asked to develop rules that address this hazard. The resulting rules are designed to protect employees from the potentially detrimental health effects of exposure to unhealthy and hazardous levels of wildfire smoke. These rules apply to all workers in Oregon and require the training elements discussed in the outcome and objective slide. Before we dive in, let's talk about the following exemptions of the rules. Enclosed buildings and structures where the air is filtered by a mechanical ventilation system and windows, doors, and bays are kept closed, except when it's necessary to briefly open doors to exit or enter. Intermittent exposures, work activities that require less than 15 minutes at an AQI of equal than or greater to 101 for a total exposure of less than an hour in a 24-hour period. Emergency operations directly involved in the restoration of essential services are exempt. However, employers must still provide NIOSH-approved filtering facepiece respirators for voluntary use at an AQI of equal than or greater to 101. Employees working from home. Now let's discuss the dangers of wildfire smoke. What is wildfire smoke? Wildfire smoke is a complex mixture of gases and particles from burning vegetation and other materials. As wildfire burns, different compounds are released into the smoke, such as carbon monoxide, carbon dioxide, hydrocarbons, particulate matter, benzene, acrolein, and aldehydes. Wildfire smoke is made up of many different types and amounts of potentially toxic compounds and can change very quickly depending on factors in the wildfire environment, such as weather, fire behavior, the type of vegetation burning, and any man-made materials. Exposures of varying types and amounts of compounds in wildfire smoke may occur. This rule addresses the fine particulate matter contained in wildfire smoke that has an aerodynamic diameter of 2.5 micrograms or smaller and measured in micrograms per cubic meter, known as PM25. To put this in perspective, a micron is 1/1,000,000th of a meter, and these particles have a diameter of 2.5 micrometers or less, which is about 3% the thickness of a strand of human hair. The small size of these particles allows them to reach deep into the lungs and even into the bloodstream. Air Quality Index, or AQI. A system called the Air Quality Index, or AQI, is used to measure the concentration of wildfire smoke. In the U.S., the AQI has number values ranging from 0 to 501 and has 6 different risk categories. The AQI number can reflect any of the 5 different contaminants. Each contaminant is measured separately, and the highest of these is what's reported on the AQI. This means that the AQI is reflecting what's most harmful at the time, and with wildfire smoke, it's PM2.5. When the AQI reaches 101, Oregon's wildfire smoke requirements take effect. There are several ways to check the AQI number in an area. EPA's Air Now website or app allows you to enter a location to find out the current AQI. EPA's Air Now also has an interactive map feature. Simply click on a square in the map and it will display the AQI for that area. Go to fire.airnow.gov. The Oregon OSHA Department of Environmental Quality publishes air quality data. Go to oraqi.deq.state.or.us. If none of the above options are available, the 531 Visibility Index from Table 1, Appendix B of the rule, can be used to estimate AQI. Symptoms. The risk of experiencing symptoms and adverse health effects due to smoke exposures varies from person to person. Persons can have different individual risk factors such as age and health conditions or pre-existing heart or lung diseases that make them more likely to be affected by wildfire smoke. Let's review some of the common symptoms of smoke exposure. Eyes may react to smoke exposure with a burning sensation, redness, and tearing caused by irritation and inflammation that can temporarily impair vision. Respiratory symptoms include runny nose, sore throat, cough, difficulty breathing, sinus irritation, wheezing, and shortness of breath. Other symptoms are fatigue, headache, irregular heartbeat, and chest pain. Potential health effects. While not every person has the same sensitivity to wildfire smoke, it's still important to avoid or minimize breathing smoke if you can help it. And when smoke is heavy, such as what can occur from large-scale wildfire events, it's hazardous for everyone. Wildfire smoke is a complex mixture that consists of other contaminants that have also been shown to lead to a variety of health effects. The health effects of particle exposures can range from relatively minor eye and respiratory tract irritation to more serious health effects, such as exacerbation of asthma, heart failure, and premature death. We'll discuss respiratory and cardiovascular effects in the next few slides. Respiratory effects. The respiratory system is the network of organs and tissues that help you breathe. It includes your airways, lungs, and blood vessels. Fine particles in wildfire smoke are respiratory irritants, and exposures to high concentrations can cause persistent coughing, phlegm, wheezing, and difficulty breathing. Even in healthy people, exposure to fine particles can potentially lead to transient reductions in lung function and pulmonary inflammation. Respiratory effects may include bronchitis, reduced lung function, increased risk of asthma exacerbation and aggravation of other lung diseases, increased risk of emergency room visits and hospital admissions. Cardiovascular effects. Particle exposure may also affect the body's ability to remove inhaled foreign materials, such as viruses and bacteria from the lungs. Short-term exposures, such as days to weeks, to fine particles are associated with increased risk of pre-existing cardiovascular diseases becoming worse. The cardiovascular system consists of the heart, blood vessels, and blood. Cardiovascular effects from exposure to wildfire smoke may include heart failure, heart attack, stroke, an increased risk of emergency room visits and hospital admissions. Certain populations may be at greater risk of experiencing a health effect due to wildfire smoke and may experience more severe effects. These groups are more commonly referred to as sensitive groups. We will discuss this topic further on the next slide. Sensitive groups. Sensitive groups include people who may be more sensitive than others to the hazardous air contaminants in wildfire smoke and should especially take precautions to avoid or limit exposure. Workers who could have higher sensitivities include adults over the age of 65, pregnant women, and people with Lung disease, such as asthma or chronic obstructive pulmonary disease or COPD, including bronchitis, emphysema, and those who smoke. Respiratory infections, such as pneumonia, acute bronchitis, bronchiolitis, cold, flu, or those recovering from severe respiratory illness. Existing heart or circulatory problems, such as irregular heartbeat, congestive heart failure, coronary artery disease, angina, and those who have had a heart attack or stroke. Diabetes, and medical or health conditions that could be aggravated by exposure to wildfire smoke as determined by a physician or licensed healthcare provider. Reporting health symptoms. Oregon Law 654.0625 protects employees who raise safety or health concerns. You have the right to report health issues related to wildfire smoke and exposure and obtain medical treatment for such workplace exposures without fear of retaliation. If health symptoms are exhibited from wildfire smoke exposure that necessitate immediate medical attention, such as but not limited to asthma attacks, difficulty breathing, and chest pain, contact security immediately. Per the GSAFE Employee Emergency Action Plan, addressing medical situations related to wildfire smoke exposure. Filtering face piece respirators. Let's talk about respirators. Respirator masks worn correctly can provide some protection by filtering out fine particles in the smoke. While there are many types of respirators available, you will want to use a filtering type, which will filter out the hazardous particulates in wildfire smoke. Ensure your filtering facepiece respirator is NIOSH approved, with one of these numbers displayed on it: N95, P95, R95, N99, P99, N100, or P100. The numbers indicate the filtration. For example, an N95 respirator should filter at least 95% of airborne particles. Regardless of which respirator you are using, if the smoke is still causing irritation, please consider using a better fitting respirator. Limitations of respirators. Although wearing a filtering facepiece respirator is a good way to protect yourself against the harmful health effects of wildfire smoke, there are some limitations to consider. Wearing a respirator, especially if it's hot or you are physically active, can increase the risk of a heat-related illness. Always consider taking a break often and drink water. If you have difficulty breathing, are dizzy, or have other symptoms while wearing a respirator, notify your supervisor and go to a place with better air quality if available and remove the mask. People with heart or lung disease may be particularly sensitive to the added work of breathing when using a filtering facepiece respirator. If this is the case, it's best to consult with your doctor prior to the use of the mask. Note: if you choose to voluntarily wear a filtering facepiece respirator, it's important to understand certain precautions need to be taken to be sure that the respirator itself does not present a hazard. If you choose to wear a respirator, Google requires employees to read and acknowledge OSHA Appendix D. Facial hairstyles. Another limitation to consider is that facial hairstyles may prevent the filtering facepiece respirator from creating a tight seal. Without a tight seal, it cannot filter out all the hazardous particulates in wildfire smoke. However, while using a filtering facepiece respirator with facial hair is normally non-compliant for all other work-related hazards that necessitates required use, Oregon OSHA strictly allows the exemption only for wildfire smoke due to the effects of the exposure for the typical worker and the limited duration of filtering facepiece respirator use. While the hazard is serious enough to warrant effects to reduce the risk due to the known effects of PM2.5 contained in wildfire smoke on the human body, it is not significant enough to represent a respiratory hazard that triggers the full requirements of the respiratory protection standard when the AQI is below 501. Workers must conduct a seal check when donning the filtering facepiece respirator and make the necessary adjustments to minimize leakage. Let's watch a tutorial on how to fit and wear an N95 respirator.
A disposable filtering facepiece respirator, also known as an N95 mask, helps protect against airborne particles, but not gases. To get the most protection from an N95, you need to understand three things: how to put it on, how to make sure it is properly positioned on your face, and how to remove it. The following are general instructions. Always read and follow the instructions supplied by the manufacturer on the use, maintenance, cleaning, and care, and warnings about the limitations of the respirators. Putting on an N95. Using one hand, place the respirator on your face with the nose piece at your fingertips, allowing the straps to hang freely. The nose piece should span and cover the bridge of your nose. The respirator should cup your chin. Pull the top strap over your head, resting it high on the back of your head. Pull the bottom strap over your head and position it around your neck and below your ears. Do not crisscross the straps. Make sure your mouth and nose are covered by the respirator. If it has a metal nose piece or strip, use both hands to mold it to the shape of your nose, ensuring a proper seal. Each time you put on the respirator, you want to make sure it is properly positioned on your face. This is done by conducting a seal check. The idea is to make sure that air is not leaking between your face and the seal of the respirator. To conduct a positive pressure seal check, cover the surface of the respirator with your hands so air is prevented from passing through the filtering facepiece. Gently exhale to see if the facepiece bulges slightly. To conduct a negative pressure seal check, take a quick deep breath to see if the facepiece collapses slightly. If you feel air blowing through the seal on your face or eyes during either of the seal checks, then the respirator may not fit your face properly. Readjust the fit and check the seal again. Removing an N95. To remove the respirator, cup it in your hand to maintain its position on your face. Pull the bottom strap over your head. Still holding the respirator in position, pull the top strap over your head and remove the respirator. Store the respirator away from contaminated areas. Before using the respirator again, inspect it for damage or missing parts. If there is damage or missing parts, dispose of it. If the N95 is contaminated, or if you sense restriction to your breathing, dispose of it. Thanks for watching.
Oregon OSHA rule respirator requirements. Whenever exposure to PM2.5 is at or above an AQI of 101, Oregon OSHA requires employers to ensure that appropriate NIOSH-approved filtering facepiece respirators are provided to employees at no cost, strictly for protection against wildfire smoke. Respirators must be stored and maintained so that they do not present a health hazard to the user. There are Oregon OSHA control requirements at each AQI value range as shown in the table. Next, we'll discuss our G-Safe company-specific procedures. G-Safe Oregon Exposure Control Methods. The G-Safe Oregon Exposure Control Methods consist of the following. When wildfire smoke is forecasted to be in the area, locations on where to obtain filtering facepiece respirators for voluntary use will be communicated to employees via email and in meeting notes before exposure. When exposure is at or above an AQI of 101, managers will work with employees to ensure the following engineering and administrative control methods are implemented to reduce PM2.5 exposure to less than AQI 101 and provide protection from the dangers of exposure to wildfire smoke as follows. The locations to pick up or replace filtering facepiece respirators for voluntary use will be provided in security's site-wide communication emails, and relocation of outdoor activities to indoor areas where the air is filtered by a mechanical ventilation system, or vehicles where the air is adequately filtered, or enclosed areas with portable air purifiers equipped with HEPA filters or similar high-efficiency air filters that are sufficient in number and performance for the size of the enclosed area. Intermittent work activities, not to exceed 15 minutes at an AQI of equal than or greater to 101 for a total exposure of less than 1 hour in a 24-hour period. Review any hazardous job tasks where filtering face piece respirators can't be used to protect employees from wildfire smoke, such as electrical work that requires fire-resistant clothing to be worn. G-Safe Oregon Exposure Control Methods. At an AQI value range of 101 to 250, security will monitor AQI conditions and provide site-wide email updates as conditions change. NIOSH-approved filtering face piece respirators for voluntary use will be communicated and made readily available at designated locations. When conditions reach an AQI of 101, managers will work with employees to implement the following controls. Relocate to enclosed or indoor areas filtered by mechanical ventilation or HEPA filters. Googlers are not required to do any work that requires the use of a respirator. As a result, controls to return to indoors must be implemented at an AQI of 101. G-Safe monitoring and two-way communication system. Security will monitor ambient air conditions for the presence of wildfire smoke to inform employees when they are or are likely to be exposed to an AQI of 101. Monitoring method. Security will monitor AQI on an hourly basis by using the following method. Checking current average and forecasted AQI from either EPA's AirNow or Oregon DEQ's website for the Dow's Cherry Heights monitoring station, including any air quality advisories or notifications issued by Oregon DEQ or the local government health agency. Two-way communication system. Security will notify exposed employees of any changes in the air quality at their work location that would require an increase or decrease in the level of exposure controls via site-wide email templates based on the AQI risk category. The site-wide email template provides instructions on how employees can report the following: any health symptoms that may be the result of wildfire smoke exposure and could necessitate medical attention, and any issues with locating filtering face piece respirators. Let's wrap up what we know so far. Now that you've completed this course, you've learned the following. Security will assess, monitor, and communicate AQI levels via site-wide emails. AQI levels above 101 are considered unhealthy. The most effective ways to protect yourself from wildfire smoke are to stay indoors, limit time outdoors, and reduce physical activity. At AQI levels of 101, filtering face piece respirators for voluntary use will be provided. If you choose to wear a respirator, it is important to understand that you need to take certain precautions to be sure that the respirator itself does not present a hazard. At AQI levels of 101, managers will work with employees to ensure the following control methods are implemented. Relocate to indoor areas where the air is adequately filtered. 2. Work activities must not exceed intermittent employee exposures as defined by the rule, less than 15 minutes in an hour at an AQI of 101, so long as total daily exposures are less than an hour in a 24-hour period. 3. NIOSH-approved filtering face piece respirators will be provided for voluntary use. If you volunteer to wear a respirator, Appendix D must be completed. Congratulations! On behalf of the DC EHS team, congratulations on completing this course. Next steps: final quiz and explore helpful resources.